The current Ebola outbreak has added urgency to research into the deadly disease, and it's put a spotlight on Boston University's controversial Biolab in the South End. Activists have called the lab a danger to the neighborhood, but after years of delays, researchers there could soon be taking critical steps toward advancing our understanding of Ebola. WGBH News reporter Ann Mostu has more.
Boston University's Biolab has sat largely empty as the permitting process has gone on for 11 years. But Professor John Connor is already studying viruses like Ebola.
We are very interested in the virus and understanding how it functions, how it works, how to stop it.
But Connor isn't working with Ebola directly because the lab is still awaiting a level 4 permit needed to handle the deadliest pathogens in the world.
A lot of the approaches that we've taken have been almost standoff approaches where we use surrogate viruses and other approaches in order to look at what it does.
The inability to work directly with Ebola is limiting Connor's research at a time when it's needed most.
This outbreak in Western Africa, in order to be contained, needs a lot of logistics, right? Needs a lot of additional help on, if this person is infected, how do you find their contacts? How do you check and make certain they're okay?
As for treatment, Connor says scientists can only theorize why some infected patients survive, while others don't.
The early evidence indicates that survivors are doing a much better job of mounting an appropriate immune response, whereas the non-survivors are mounting a non-effective immune response that is also harming the infected individual, essentially making the infection worse.
The promise of new treatments for the deadly disease is no consolation for Claire Allen. The Roxbury activist filed a federal lawsuit to block the Biolab, calling it a danger to the neighborhood.
We still feel that the risk assessment is adequate, but we don't feel as though that we're safe, and we don't feel that BU has enough knowledge to do this type of research.
Allen is concerned about an accidental release of pathogens and says there are already enough level 4 facilities in the United States.
There are anywhere from 10 to 17 of these labs that already exist. So we're really not, understanding why it is that one more would make a difference. As you see that's happening with the Ebola, there are several universities with level 4 labs that are handling the situation.
BU is expecting its level 4 permit to be approved in 2015. Only then, researchers say, can they start making real headway against Ebola. With
this disease, as with most diseases, the longer you wait, the harder it is to be effectively treated.
Ann Mostu, WGBH News.
Here to talk more about the Biolab and the Ebola studies that could be soon underway there is Dr. Ron Corley. He's an infectious disease expert with Boston University School of Medicine and director of the Biolab. Welcome to Greater Boston.
Thank you very much. Pleasure to be here.
I want to put this in the right context, but are you excited in a way about being able to do this research on the level 4 pathogens?
Yeah, absolutely. We're very excited about it. I think the uniqueness of the Biolab is that we are able to study pathogens no matter what biocontainment level you need to work with them at. This gives us a unique opportunity to work safely with pathogens in such a way that they are not a threat either to the researchers or the community.
How do you convince people like Claire Allen, who's been an opponent of this for as long as the proposal has been out there? How do you convince them that something can't get out, that it can't come on clothing, that it can't get under a fingernail? How do you convince them?
Well, at some point you almost cannot. I mean, the problem is that the lawsuits required that the federal government go back and do a supplemental risk assessment. It's the first and only true risk assessment that's been done on a biological facility in the United States. It took more than 3.5 years. It was reviewed by 2 panels of scientists. Those 2 panels both agreed that it was an appropriate and adequate risk assessment, scientifically sound, and the risk assessment concluded that there was no risk. And in many respects, it's safer to have a facility like this in a city, where many already are around the world.
So I'm curious about Ebola and other pathogens like that itself. I mean, can you see it? Do you know what it looks like? How do you determine? We think we know how it's transferred, but do we really? How do you go about dissecting it?
Well, a virus like this you don't see unless you look under an electron microscope.
Yeah, no, that's what I mean. That's what I mean. Can you see it under?
You can see it under an electron microscope. The way you diagnose it is you look for the virus by doing what's called polymerase chain reaction, which is a technique that allows you to to see whether there are small amounts in the blood of an infected individual. By doing PCR, you can diagnose an individual as having Ebola or not having Ebola. Problem is that technique only works on people that are already showing symptoms and they're therefore already infected and infectious to other people. What you'd really like to be able to do is back that timeline up.
Do you hope to be able to get to the point where you've got a vaccine? I mean, what?
Well, I think there are several issues here. One is a vaccine the right way to go? I mean, this has been a niche virus essentially for a number of years. It hasn't affected a large number of people, so no one's ever thought of it as a true health hazard. The reality is, what this proves to us is that even very difficult to transmit viruses like Ebola virus are viruses that, in fact, if they get into cities and resource-poor areas, can spread out of control and become true global health threats. That's why it's really important to make therapeutics and get diagnostics that allow you to diagnose these viruses much earlier than we're currently able to, and do so outside of sophisticated laboratories.
Are we creating a panic situation here? We had the individual die in Dallas today who came in from Liberia with the disease, but he brought it in here, but now people are worried about that. Should they be?
Well, I think there's always a worry among close contacts to a person after they've become symptomatic. And so I think those people are appropriately worried. And I think healthcare workers and public health servants are spending time trying to make certain that they are watched carefully, so that if they become symptomatic, they don't spread the disease. It isn't a very difficult, I mean, it is a very difficult disease to get, as I've said. And so, but because it kills such a high proportion, it is a scary virus. And this is what, sets people off. They get afraid of this. And of course, this is the stuff of science fiction movies as well.
Absolutely. There's going to be other deadly pathogens you're going to be working with too.
Well, there's a number of other pathogens that we're interested in working with. I mean, the reality is, whether you like it or not, emergent infectious disease is a growth industry, in the sense that there is a new pathogen, a new human pathogen that's recognized at the rate of about once every year and a half.
Wow.
So that means 5 years from now, there will be 2 or 3 new pathogens that we've never recognized as being pathogens of humans that require safe labs in order to study them and develop those diagnostics and therapeutics to treat them.
All right. Good luck with the Biolab.
Well, thank you
Ron
very
Corley,
much.
Pleasure to have you here.